we're preparing to have some blood taken to do some very in-depth testing.
Just based on your height and your weight.
Yeah.
Next. Blood pressure. Do you know what your blood pressure reading normally is? I can promise you this. I'll never be able to get an accurate blood pressure reading on your arm.
Yeah,
just from the size.
Yeah.
It's going to be.
They usually use the extra cuff.
Yeah.
It's usually normal. Yeah.
This is going to generate something called the Framingham score, which has been used for 40 years. Dr. William Castelli in Framingham, Massachusetts, 40 years ago, he was a cardiologist. He asked the question, how do we know who's going to get heart disease? And they just came with a simple formula in Framingham, Massachusetts. They measured height and weight. They measured blood pressure, whether you're a smoker, diabetic. They measured simple things that they could do on a blood test 40 years ago, and that is your cholesterol numbers, the HDL, the LDL, triglycerides, hemoglobin A1C, known as a marker for diabetes, glucose, and C-reactive protein. And we put that data in, so this machine is going to give us a Framingham score. But the power of this tool, which is a Panasonic CIMT ultrasound, it's the ultrasound probe that's looking in your blood vessel for atherosclerosis. So the data that's punched in, do you think that's more or less valuable than what the machine is actually seeing inside? These are just numbers.
Right.
What's actually happening in the blood vessel, and that's why the American Heart Association says this machine should be in every doctor's office, because it's much more valuable than the cholesterol number, which we rely on so much. So let's put in your data here just so we have it. We have a cholesterol of, we have an HDL and an LDL. And then triglycerides are excellent. The A1C and the glucose. And excellent on the C-reactive protein. So that data is in, and now we're ready to do the scan. So I'm going to have you hop up here. So you're going to step up, sit down. Great. So all you have to do is to keep your head at about a 45-degree angle, the wedge, put your head down. So about 45 degrees. So the carotid artery is right here where my finger is. I can feel it right there as I'm touching. We use a little bit of ultrasound jelly. It will feel cold on your neck. It's just a salty jelly. I'll wipe it off when we're finished.
Okay.
So the first view is a cross-sectional view of the carotid artery. And right here is the artery itself. This is the jugular vein. You can just see it right there. Jose, if you bear down and strain a little bit, you see that jugular vein pops right up with the pressure. Relax. But so we're on the carotid artery right here, and we'll just take a, there it splits. We have the internal and the external branches. The internal branch goes to your brain. We're going to take a picture of that right there. We're going to save that picture. Now we know where the vessel is, so we'll do a longitudinal view or long axis view. And this is the carotid artery right here. I just want to position it in the appropriate place. The machine is automated. Okay, we already have one reading. We're going to keep going. We're not quite in the right position. But so when the machine hits it, it finds its target, it makes 10 readings of the thickness of atherosclerosis on the blood vessel wall. And there we have a reading right there. So the cursor has to be in the bifurcation of the carotid artery. This is a 1 centimeter box, and it's taking readings in that box. We're going to do this one more time. And let's position this correctly here. And we have a very good reading there. Okay. So we're finished on the right side, but we'll get twice the data if we look at your left carotid artery. Now, although we're scanning the neck, this is also helping us to understand what's happening inside of the blood vessels to your heart. There is about a 85 to 90% correlation between the blood vessels in your neck and the coronary vessels to your heart. So that's what we're wanting this to help us not only understand what your stroke risk is, that's the blood vessels to your brain, but what is your heart attack risk. So we'll do the long axis view, positioning this over the right there. Get that lined up. There is a color indicator which tells us when we have a high quality signal. It turns green. There we go. We're getting a nice clear reading. And we'll do that one more time. We're done. I'll wipe that off. I'll help you get up off the table, and then we'll have the computer analyze the results.
All right. Was easy enough. Yeah. This is great stuff. I believe a friend of mine had this done not too long ago. He ended up having to go and get a stint. He was just doing it randomly to check. And found some pretty disturbing news.
Well, maybe there was a reason that he had the test done. Maybe in his family he had somebody who had died of a heart attack, and he was worried, or
I think it was that, and that he had access to a machine like this.
Why don't you come on this side? You're going to look at the screen. You were laying down, so you can't see this, but this is a diagram of your body position. The probe is indicated here. It has to be in this blue zone, and there's a gyroscope in the probe that tells us what the angle is where we capture the picture, because year to year we can measure this again, and we can hold it in the same position on the blood vessel and see if the layer of atherosclerosis is worsening year to year, or if it's improving. This is where the blood vessel is starting to widen a little bit. That area is called the bifurcation of the carotid artery. So the carotid artery is basically splitting, and the big branch goes to the brain, the smaller branch goes to your facial muscles. So this dotted line has to be located here, and there's an international standard how this is done. It's always the back wall. It's a 1 centimeter box. We have a very strong signal here, the bright green color, and then between each one of these dots the machine is recording how thick is the layer of atherosclerosis deposit. Atherosclerosis is the bad cholesterol which is coating your blood vessels, so you can think of it that way.
Right.
But this blood vessel, this black tube here, is wide open. There's no blockage. It's not obstructed in any place. It's wide open right now. We want to know at this time right now, are you building up atherosclerosis that 10 years from now is going to be a blockage? Because when is it easier to stop the process? It's easier to stop the process here, where the blood vessel is still wide open, than 10 years ago, where all the blood vessels in your body are starting to be plugged up. Okay, so you want to stop it now. Down here is your heartbeat, and the machine has to record this at a relaxation phase, because that blood vessel is stretching and moving the whole time your heart is beating. So let's go ahead and ask the machine to give us a report. I'm going to press this button. It'll tell me that I can't modify the results once the report has been created. The first page is the Framingham risk score, and it takes this information that we put in, and it gives an estimate of what your risk is in the next 10 years, what your risk of a heart attack is in the next 10 years. It's very heavily based on cholesterol numbers, because that's what they had 40 years ago.
Right.
Cholesterol, smoking, diabetes, those were the risk factors, and obesity. For you, it's telling us that based on traditional risk factors only, your 10-year risk of a heart attack is estimated to be at 7%. And that's a pretty low risk. That means that if I had 14 men your age, right here, right now, with these sort of results, 1 out of 14 would have a heart attack in the next 10 years. That's a pretty low risk, huh?
It doesn't seem that low.
Well, yeah, okay. You'd rather have it be 1 out of 100,
yeah,
right? Now, if I slide this down, we're seeing the actual data. I will tell you that on this presentation, you're below the age of 45, so we're not seeing your results on this speedometer, what I call the speedometer up here. We'll see it on another page. But the actual numbers that the machine is measuring is 0.563 on the right. That's in millimeters. So 0.5 of a millimeter is the thickness, and 0.6 on the left. That's somewhere down around about here in terms of what your blood vessel health is. I like this presentation much better. This is a graph. This is a graph called which was a report called the Multi-Ethnic, MESA, Multi-Ethnic Study of Atherosclerosis. This was thousands and thousands of patients in the United States who were screened using this test, and they took their age and they took the thickness of the measurement, and they created this graph. And you can see on the bottom axis here, age 40, age 50, age 60, age 70, age 80. And then the thickness of the layer of atherosclerosis is measured here on the vertical axis, 0.4, 0.6, 0.8, etc. Cholesterol plaque, by definition, is 1.2 millimeters. So if there's an area in here that is very thick with atherosclerosis, then we can say you have cholesterol plaque, especially if it hits the number 1.2. Okay? You don't have that. Your pipes are wide open. Okay? But your number here is 0.563, and there's 3 colors of these graphs that start at age 45. You're close enough that we can see where you are relative to that. I'm going to move this number a little bit. So you're very close to the green and lower than the blue. The green is the 25th percentile. So if we take all men who were tested age 45 and we took their number, the thickness of atherosclerosis, the guy who's at the 50th percentile for his number, he's the blue line. Yeah. He's the halfway point of all the men in America age 45 who were tested. You're somewhere between the 25th and the 50th percentile. Okay? I have had people who walk in here, even in their 40s, who have numbers way above the red line. The red line is the 75th percentile. Right. So they're in their 40s, but they're way ahead of what's normal and what they should be. Let's look at the left side, the left side of your neck. Your number was a little bit higher there. So on the left side, your number is 0.647. And if you eyeball that, that's about the 50th percentile line. Right. So you're about average for American men right now. However you lived your life in the past 20 years, it has produced this result. The question is, what's going to happen in the future? Because if you look at the progression of this graph, as Americans get older, green, blue, red, as Americans get older, the deposits of atherosclerosis get worse. Which means that the layering inside of your blood vessels is going to get worse.
Right.
If you do what everybody else does. But dependent on lifestyle and how you take care of yourself and the treatment that you get, these blood vessels can stay whistle clean for the rest of your life. You can keep the same numbers, and while everybody else is getting worse, and the layering, the thickness of atherosclerosis is getting worse and worse, you actually are staying here at the same number, and at 10 years from now you're going to be below the blue line. 20 years from now you're going to be below the green line. That means that 75% of people are going to be worse than you, and your blood vessels will be wide open. So there are strategies that you can do right now and maintain a healthy, good lifestyle, healthy, good eating habits, and you can keep your blood vessels healthy the way they are right now. Okay?
It's great news. Because I intend to be healthier in the upcoming years. You know, continue to...
As you're
do
getting
lots of
older,
cardio.
you probably won't be training the way you have.
Right.
You won't push your body as hard as you have. But that doesn't mean that you should get into sloppy or bad habits.
Exactly.
You probably won't be 6% or 7% body fat forever. That's very hard to maintain.
Right.
But keeping your body fat percent in the teens, the mid-teens or the low teens, is ideal.
Yeah.
And you certainly want to do that. But this is a good test result today.
That's great.
Okay.
I'm happy. Thank you very much.
You're welcome.
See that? See that, people? Ignore the 40-inch waist part and just focus on the good results.
I think that's 40 inches of muscle.
Yeah, exactly. And you got a little lat in there, a little rib cage. That's great. Well, thank you very much. I was excited
You're
to
welcome.
get this done.
Alright, this is the Boston Mass. Thanks again for watching. Now, if you're not subscribing, subscribe now. Tell all your friends to subscribe. If you haven't, do it now. Alright?